Do varicose veins recur after venous treatment? Does the patient follow the advice given by the doctor? Having a recurrence or not needs to be diagnosed early. We need to have ultrasound follow-ups at regular intervals. If that is done, recurrence can be caught early, you could be treated early. Hi, I'm Dr. Saurabh Joshi. Do varicose veins recur after venous treatment? The short answer is yes, can be. It's not necessary that it may not recur. The long answer is may or may not. Now, there are certain factors that influence recurrence. There are some technical factors depending on how the procedure was done, how large the veins were during the procedure, what was the experience of the operator while this was done, were the precautions which were advised to the patient followed or not followed, and there are some patient related factors. Does the patient follow the advice given by the doctor? Do you still stand for 8 hours a day? If you had some bunches of veins and sclerotherapy was done, were you advised wearing compression stockings? And are you wearing them or not? Have you increased your weight? Were you on the higher BMI side? And if it was advised to you to reduce your weight but you still could not, these can be the factors that affect recurrence. Now, what do we do about it? Having a recurrence or not needs to be diagnosed early. All patients having varicose vein procedures, whichever procedures, if it's stripping surgery or ligation, thermal ablation procedures or venous procedures, these patients need to have regular checkups. Typically, a follow-up schedule for a patient post-procedure would be an ultrasound 7 days post-procedure, 2 months post-procedure, 6 months post-procedure, and then once a year, just to make sure that there are no new veins developing, and if some intervention is required, it can be done early. Now, if the veins are recurring or some new veins are developing in the earlier period, we can simply do some sclerotherapy to get it better, or if we can modify the risk factors. If we know that some veins are enlarging, but we know that the patient has put on 10-15 kilos of weight, and if we advise to better weight management and some compression, the problem might be solved. If the patient had an ulcer previously and there are some veins which are developing near the ulcer which might cause the ulcer to open back again, then we can take a call to do a procedure or a minor procedure just to close those particular veins to prevent the patient from getting a recurrent venous ulcer. So yes, there are chances of veins recurring after any procedure, be it open surgery, be it laser, be it radiofrequency ablation, be it venous seal, be it plain sclerotherapy. But there are certain factors that define it, some technical factors which are dependent on the operator, and some patient related factors. But the most important part, whichever factor is there, is the good follow up. We need to have ultrasound follow ups at regular intervals, and if that is done, recurrence can be caught early, you could be treated early. If there are no follow ups, even if there is recurrence, you will come to know after 2 or 3 years when it is beyond a certain procedure where you might need to do the whole procedure again. That's why when you're getting operated for any of your varicose veins procedures, please ask for the follow-up schedule. Are you going to do an ultrasound and after the procedure? And if you're doing it, please give me a written down schedule. That will help you prevent recurrence. Thank you.